Hello, this is group 2. My name is Danielle James.
I see Juan.
Kingsley Uchenwa.
Ali Hop.
America Bezwe.
Nyango Nono. This is group 2, and our topic is bronchitis and emphysema.
Five more minutes. One more minute. Okay, that's it. I'm done.
Damn, guys.
No.
Man, forgot.
My favorite exam.
How was it? No.
How was it, man? How'd you do?
Man, that exam, you gotta smoke, man.
Oh.
Why?
Really?
Why?
Is that a
It wasn't
cigarette?
that bad.
It wasn't that bad. Is it that bad?
Stop
that. Leave him. He got one smoke. Let him smoke.
Why do you have to smoke?
No.
He's really doing it. Can't you guys
Wait,
see it?
but why are you smoking?
Yes,
Like,
he
that's
really is
not
doing it.
Was it that bad? Like, you need to smoke, like, for real? What's wrong,
That's
man?
crazy. Now he's a smoker.
Relax on mine and I smoke.
Oh, yeah.
Oh, really?
You need to just
Still not
relax.
bad.
That's all you need to do.
Yeah. Smoking is for bad people.
Why's
Yeah.
that?
He
Why's
said
that?
it's for
Why's
bad
it bad?
Because you can catch bronchitis.
Oh, bronchitis.
And emphysema.
Wow.
You could catch
Yeah, do you
bronchitis
not
or
know about
emphysema.
bronchitis?
No.
No.
No,
Are you
Take it easy, man.
It's not
You
because of
okay?
the smoke.
Yes, it is. See, bronchitis, what it does is that it inflames your lungs.
Are you okay?
Are you okay?
Do you have to call 911 for you?
So do you know about bronchitis though?
I have no idea.
Well, what it does is that it inflames your lungs, so it's like an infection. It's irritating, and you're going to start coughing and wheezing. Like most patients that have bronchitis usually have that issue. Did you not know that?
And so does emphysema. It reduces lung capacity, man.
What? So what?
I'm telling you.
And there are two different types of bronchitis. There's acute bronchitis and there's also chronic. Acute only lasts for like 10 days.
Right.
So you just have a little irritation. But if you keep smoking the way you do, you're going to have chronic bronchitis.
And be screwed.
I think we need to go see somebody. Why don't we
Stop,
go
stop,
check
stop,
up on you?
Seriously, that cough was not good.
Can I take one more? Can I take one more?
No.
Right now, stop it.
So we're going to go see somebody right now so she can find out about bronchitis.
All right.
Let's go.
All right, let's
Let's
go.
go.
Let's go.
Yesterday, lady fell down the stairs and she died. Yeah, she saw.
Hello.
Hello, how you doing,
Hi.
sir?
How are you? I'm good. How are you? My name is Onyango.
My name is Dr. Hop.
How you doing? I have
Dr.
an appointment
Bezwe, nice to
today
meet
at
you.
8:00.
Yeah, we're expecting you.
So,
Have a seat.
Have a seat. What brings you into it?
Well, I'm a pharmacy student, so after my exam, kind of like was smoking outside outside,
Right.
and my classmates were like, "Why are you smoking? You might be developing some type of bronchitis." And they referred me to come see you guys. So I'm not sure. I don't really understand what bronchitis really is,
Right.
but I want to know if it affects my health. You know, so.
Sure. Is there anything that you experienced in particular? Any symptoms? Any coughing, wheezing, shortness of breath?
Well, it seems like lately I've been coughing a lot more than usual. You know, like when I sleep, I tend to cough a lot. I just thought it was normal, but I still smoke. So
Excessive coughing?
excessive coughing.
In relation to how many packs of cigarettes do you smoke a day?
I smoke about 3 to 4 packs a day. You know,
That's a lot.
I mean, I get a lot of stress. I still got a stressful work, stressful class.
Yeah, that's still.
So,
What do you do for work? If you don't mind asking.
right now I work part-time, full-time student, part-time work as a construction worker. So
Right.
so I help build houses, tear down houses. Sometimes I come across like stuff like dust or pollution in air, and that kind of gets me going, coughing again. So I'm not sure, or shortness of breath. I'm not sure if
Right.
that have linked to.
Yeah, that
bronchitis.
definitely would affect your pulmonary, your breathing, because you obviously are breathing in polluted air, so that can contribute to any coughing that you might have or any wheezing in the long run.
Wow, that's a lot. Well, you know, considering what you're going through right now, usually we have to do a couple of tests on you to confirm that you do have bronchitis or probably acute or chronic, you know, bronchitis, or it could be emphysema. We're not sure exactly, but there are a host of tests that measure this, and especially COPD when we're talking about chronic obstructive pulmonary disorders. We have a bunch of tests ranging from, you know, pulmonary chest X-rays and as well as sputum cultures, and we also have the lung function test. That's going to be able to, you know, find out how much, you know, air you're taking into your lungs and how much is being, you know, taken out. We're going to use, you know,
A spirometer machine.
a spirometer machine, exactly.
Where you breathe into it and then
Right.
it shows you the expiration and the inhalation
Right.
and how strong your lung
How,
capacity is.
your lung capacity is going to measure your lung capacity, how much air you're taking in, and how much air you're taking out. It's going to measure a whole range of, you know, different types of things you're going to be experiencing when you usually breathe in. So, and like I said, the cigarettes could, you know, play a part in reducing the capacity of your lungs right now. So we don't know exactly.
Especially if you're doing 4 packs, that can definitely
Yeah.
do some major damage to yourself and the job that you do.
You know, I work out, and I used to work out. I used to lift like 300 pounds, sometimes more than 300 pounds. But now it seems like I can't really get
Right.
one rep going.
There's something definitely wrong. Your lungs have reduced capacity right now. You can't take in as much air or oxygen as you should. That's why you're not having enough energy to actually, you know, lift those weights that you usually lift before. You know what I mean? So it could be a host of things. You're gonna have to do chest X-rays to make sure that you're not suffering from any type of lung disorders or, you know, charred lungs or, you know, reduced surface area, stuff like that.
And then if, let's say, we diagnose you with hopefully acute chronic or acute bronchitis, we'll just be treating the symptoms, so you probably take some NSAIDs to help with any of the pain that you might experience from coughing or to lower the inflammation that you might get. And then maybe a little bit of like an expectorant, like Mucinex, to help all the mucus come out, the congestion, so you can cough it up. Do you have something that you feel like is stuck in your lungs?
Speaking of something,
It sounds like you have a dry mouth.
It sounds like
Yeah, so hopefully it's acute, but if it's chronic bronchitis, we might have to use some bronchial dilators,
Right.
Such as
Androgenic.
androgenic. I always have
Right.
trouble with that. Agonist, which is an inhaler, or potentially even anticholinergic, which is like Pulmicort. It's kind of what people use if they have asthma. It helps if the airways are kind of constricted
Right.
and the air is, you know, rough coming in.
Yeah.
It helps to dilate it and open it up for you. And hopefully it's not chronic, but if it is, we might have to put you on some steroids like prednisone,
Exactly.
which would help with the inflammation. And if you cut down on the smoking and you cut down on the bad habits and probably wear a mask at work, it can stop further destruction of your lungs.
So cut down on smoking. You talk about like going from 4 packs to like 2 packs a day.
I would recommend you quit. Actually,
Yeah. The sooner the better. But you can start slowly. But you have to quit smoking if you don't want a constant progression of what you're constantly going through. You know. So, but to what Dr. Habhab said, we still need to take a couple of tests to confirm that everything you're saying and everything we're expecting is, you know, going on before we can put you on these meds.
But for right now, we'll be positive. We'll say that you hopefully have acute, but we'll, you know, that's after he does the tests on you. We'll know for sure exactly. Do you have any questions for us?
There's like a lot of tests going on.
It's a lot to take in. So.
Yeah, that's my only concern. You know, like I said, I have insurance through my job, so it shouldn't be a problem covering that.
Yeah.
Just that I really want to go through a lot of tests.
No, that's true. I know.
So what we'll do is we'll set you up, and then you'll come in and we'll take some tests in the next couple of days.
Okay, sounds good. Thank you very
All
much.
right, it was very good meeting you.
Very good meeting you too, Doctor.
Nice meeting you, man. Take it easy with those cigarettes, man.
Yeah, you got to
Come back a day.
put on a mask so I can start pumping 300 again.
Right.
I want my 300 pounds. Thank you.
Alright, take it easy.
To summarize the symptom of COPD, for chronic bronchitis, there's a persistent cough that lasts for 3 months or more. Emphysema, shortness of breath may occur even if the person is at rest, because there's a carbon dioxide that builds up in blood and the person may not get enough oxygen.
Chronic obstructive pulmonary disease, also known as COPD, is one of the most common lung diseases. It makes it very difficult to breathe. There are two main forms of COPD. One, chronic bronchitis, which involves the long-term cough with mucus; emphysema, which involves destruction of the lung. Person with COPD could have both combinations.
Smoking is a leading cause of COPD. So the more the person smokes, the more likely that person will develop COPD. There are many risk factors may involve in COPD, such as exposure to certain gases or fumes in the workplace, or exposure to heavy amounts of secondhand smoke and pollution, or cooking fire without proper ventilation.
There is no cure for COPD. However, there are so many ways one can prevent the disease from getting worse, as we have already mentioned earlier in the video. All in all, someone with COPD must stop smoking. This is the leading way to stop the disease from really affecting the lung. Thank you all.